Hi, Dr. Sarah Trunk here with Balance Within Physical Therapy. Today I wanted to talk all about arthritis in our knees, why it happens, and what physical therapy can do to help. So you might be surprised to learn that physical therapy is one of the most effective treatments for arthritis if you've got anything that might be either mild or moderate. If it's super severe, yes, that is when we go the route of looking at joint replacements and things like that. But most people can get a ton of relief, if not feeling 100% better, just from physical therapy alone, especially when you're working with a specialist. So to understand why, let's talk about why arthritis happens to begin with. Most of the research really shows a strong tie between arthritis and being sedentary. That's right, not moving is the number one cause of arthritis. And why is that? Well, our joints don't get any direct blood flow, and so the way that they get nutrients and also their lubrication is through movement. So if we're sitting at a desk all day or lounging around and laying on the couch all weekend long too on top of it, our joints are not getting the nutrition and the nutrients that they need so that they can be healthy and repair. And then our body is also not getting stimulated to make the lubricant that keeps those joints nice and healthy and smooth too. So that's the number one thing. I love biking and swimming for knees, and walking too is really great. That will help stave off arthritis and keep you feeling younger and healthy in your whole body for that same reason as you age. If you are having some pain, usually it starts out by being caused by the alignment and the mechanics of the joint itself being a bit off. And so your body's telling you those joints are getting irritated and a bit extra wear and tear. So it starts with aches and pains first. And if we address it and get things balanced again before it progresses to an arthritis situation, that is the best case scenario. That means that we're preventing joint replacements and a whole lot of worry and stress and headaches down the road. So in physical therapy, let's say you come in with aches and pains, you might have arthritis, maybe not. We're gonna really work to restore the mechanics of the joint itself either way. Some of the big things we look at, I already did a video on calf stretching, so that's important to have good ankle motion. We also look at what the muscles and connective tissues all around the knee are doing, since those are really important to be nice and loose enough to allow our knees to function well. And then we're also looking at our strength and stability. We need to be strong in all of our muscles in our thighs and calves and around the knee itself. However, one of the biggest stabilizers for our knee actually comes from our core and our hip. So our knee is a simple hinge joint, and to keep things on track, our knee and our hip have to be nice and strong and aligned. So just a quick example of that would be if my hip muscles aren't nice and strong, then instead of when I stand on one leg or I'm walking, instead of those knees being nice and aligned, we're going to drop at the hip, and then that knee's going to wobble all over, and that causes irritation. So there's a lot of different things we can look at. This is just an example of a few of them. But I did just want to encourage you that if you're having any knee pain, or if you think you're starting to have some arthritis, definitely get in to see a physical therapist and do some troubleshooting. Figure out what's going on, how we can stop that progression, and really prevent big issues for you in the future. There's so much that can be done. We do have a free knee pain guide on our website available for you to download if you'd like more information. And we also are offering a few knee pain troubleshooting sessions with us this month. So feel free to shoot us an email, or you can sign up online for that free discovery consult at www.balancewithinpt.com. Thanks so much for listening.